NSAIDs, non-steroidal anti-inflammatory drugs. They are also called as analgesic, that is painkiller. There are phospholipids which get converts to arachidonic acid with the help of enzyme phospholipase. This acid undergoes two pathways, COX pathway and LOX pathway. In the COX pathway, it undergoes COX1 and COX2. COX means cyclooxygenase, and COX pathway, COX1, it will protect the stomach, and COX2 pathway, it will activate the prostaglandins, which is the main culprit for the pain, fever, and the inflammation. And this LOX pathway will form the leukotrienes. We have two types of actions, that is two types of mechanism. The first one is non-selective COX inhibitor. Next, selective COX inhibitor. In the non-selective COX inhibitor, it will subside both COX1 and COX2 pathways, and in this only COX2 pathway subside. Examples of non-selective COX inhibitor: endomethacin. It will decrease the inflammation, and it is most commonly used in osteoarthritis and rheumatoid arthritis. It is also prescribed in the patient with patent ductal arteriosus. Next, ibuprofen. This is the most common painkiller for the children. Next, mefenamic acid. This is most commonly prescribed for the dysmenorrhea. Next, the super drug, that is paracetamol. Paracetamol also called as acetaminophen. This paracetamol will inhibit a special pathway called as COX3 pathway, which is in the hypothalamus. What they do, it decreases the pain. Paracetamol is a excellent painkiller, but it is a weak anti-inflammatory, and paracetamol is excellent antipyretic. Paracetamol in the body get 90% inactivate with the help of enzyme sulfate or glucuronide, and the rest 1 to 2% will form NABQI with the help of enzyme CYP2E1, and this NABQI will get convert to the mercapturic acid, which is secreted in the urine with the help of an enzyme called as glutathione. Accumulation of NABQI is hepatotoxic. Therefore, we say that paracetamol causes liver damage. Suppose if a patient has taken 20 tablets of paracetamol, then what happens? This cycle gets saturated, and all the cycle will shift in this direction. Therefore, it causes the accumulation of NABQI, that is N-acetyl para-benzoamine quinone, and accumulation of this NABQI will causes hepatotoxic. So, to avoid or to decrease this problem, we give N-acetylcysteine to the patient. N-acetylcysteine. This N-acetylcysteine will again increase the glutathione, and it causes the metabolism of NABQI into mercapturic acid, and it will be secreted in the urine. Next, there are selective COX-2 inhibitors. They ends with the word called XIB. XIB. Now we know that paracetamol or any painkiller, it causes gas problem, that is gastritis or peptic ulcer disease. But why? See, when we are using, suppose paracetamol is a non-selective COX inhibitor, that is it will inactivate both COX-1 and COX-2. By inactivating COX-2, we are getting help from the pain, that is decrease in the fever, decrease in the pain, decrease in the inflammation. This is a very good thing, but the bad thing is here that it is not protecting the stomach. Therefore the acid will kills the stomach, and therefore it will cause peptic ulcer disease. So to avoid this problem, we give selective COX-2 inhibitor. Selective COX-2 inhibitor. It will inhibit only this pathway. This pathway will keep on functioning. The examples is the drug which ends with XIB, COX XIB, as I told here. COX-2 selective inhibitor, COX XIB. Okay, thank you.